You're listening to Eusebius McKaiser on Power 98.7. Now, we're talking.
24 minutes before 11. One of the most important issues in this election cycle is, of course, the question of health policy in South Africa. If this beautiful country of ours can reach its potential so that 90 minutes of talk radio that we've just had can be reduced to a celebration of excellence rather than moaning and engaging the critical challenges, we will need to get some things right. Education is an important ministry, but also health. We need to live as long as we possibly can to be productive citizens. That means we need hospitals that function. And in that regard, I must say we were rather disturbed as citizens. Obviously, as journalists, we'll bring you balanced viewpoints on the issue. This is a breaking news story. But as a citizen, I have to say I was shocked when I discovered a letter that is about to be published in a South African journal that medics will be able to engage in, but really should be in the public space. And it's a letter about Folateng, which is a concept whereby certain hospital beds are reserved in some of our hospitals here in Johannesburg for medical aid patients like myself. The irony is that many of these beds are allegedly not being used because you and I secretly don't want to go to Helen Joseph. We don't want to go to Sebokeng. And actually, I want to go to Sandton Mediclinic, even though they'll still give you custard and jelly. But the bottom line is, you then end up having poor patients turned away at a big hospital like Barra, and a good doctor, remember the Hippocratic Oath, are unable to say to them, at least I can refer you to Helen Joseph, I can refer you to Charlotte Maxeke, because at those places, even though there are hospital beds available, the sad reality is that in terms of a current policy, those beds have got to be reserved for Eusebius McKaiser, who never rocks up there anyway. So we're currently asking, what is it that is required to change this policy? What is the logic behind it? Is it a good policy? And why would doctors who, like lawyers, prefer to be good plumbers rather than getting involved in national policy debates, sign their names and potentially have all sorts of public and political pressure against them to a letter that has been leaked and which will appear in this journal very, very soon? Why is that the case? Well, I am very happy to say that we have important stakeholders in that regard joining us for this conversation. We're trying to get the Minister of Health, like a good citizen. He's waiting in the queue at a Home Affairs Department. And I just cheekily told the Minister, this is an important part of the conversation. So hopefully he can pull some rank there, get out of the queue and get his spot back. So Dr. Motsoaledi will join us for this conversation. I also have Kirsten Whitworth with me. Kirsten is a lawyer with the Center of Applied Legal Studies. There's an important social justice angle to this. We're going to find out how that relates to law and lawmaking when it comes to government's right to set policies. And then I've got Professor Ken Huddle from Baragwanth Hospital all with me in the studio. Professor Huddle, thank you so much for taking time out.
It's a pleasure.
And Kirsten, thank you so much as well for being in the studio with us.
Thanks, Eusebius.
I want to start with you, Professor. For many of my listeners who haven't immersed themselves in the issues over the last 24 hours, some of this may be a little bit too quick in how I'm summarizing it. As a doctor, tell us what this letter is about and what exactly the current experiences are for you as a practitioner, for some of your colleagues, and most importantly, for the average patient wanting to access certain services.
Yes, I think it's important to sketch the background to why we actually penned that letter to the South African Medical Journal. What's been happening over the past year in the Department of Medicine, which is the largest department at Chris Hani Baragwanth Academic Hospital, is that we've been experiencing progressively increasing intakes of patients to the extent that we are now overwhelmed with patients. Our bed occupancy on many days is over 100%. What that really means is that we are now accommodating patients in a most inappropriate way. So if you walk into the admissions ward at our hospital, you're likely to see patients doubled up in bed, patients on stretchers, patients on chairs. These, I might add, are very sick patients with a very high acuity of illness who really deserve to be in their own bed with appropriate care. This has been going on now for some time, and I've written letters to our administration and to the head of health in Gauteng, and I have alerted them to the problem, but we're not making much progress on remedying the situation. What we would want is that when we reach bed capacity, that we would need to close the hospital, and we can't really have more patients than beds, because we come from a history. I've been at the hospital for nearly 40 years, and in the early 1980s, we had the same sort of issue. We had patients on the floor, totally unacceptable conditions for our patients from Soweto, and we protested that, and eventually it went to court, and we were vindicated, but it was a long, hard, arduous process, and we added on facilities to accommodate the patients. But we're back to square one now in 2014, where we're having patients on the floor, we're having patients doubling up on the bed. Now, it's not good enough just for us to say we must close the hospital, because I'm aware that these very sick people don't have another place to go to, because every weekday particularly, most of the hospitals in southern Gauteng are full, and that's really a big issue. So these poor people, where do they go? They may, in my view, they go home to die. So this brings in another question. How do we remedy the situation? We're not here just to complain. It needs a strategic solution, one in the short term, medium term as well. When we analysed the situation in my department, we thought about the Folateng facilities that exist in southern Gauteng. They exist at Charlotte Maxeke Hospital, Ellen Joseph, and Sebokeng. And they add up to close on 200 beds. Now, these beds have been taken out of the public sector for private patients, patients who've got medical insurance. And to me, I've always been against this philosophy, because having a dual healthcare facility in one hospital is unacceptable for me from a moral and ethical standpoint, because you end up with a two-tier health system. So if you visit Folateng facilities, and I have stepped into Folateng at Charlotte Maxeke, you notice that the wards are much cleaner, they're well painted, trays of tea have been distributed around the ward. So the conditions are really very good for those who happen to have health insurance. Those very patients also share the hospital investigative facilities like radiology, scanning, etc. And I'm told by my colleagues who work at that hospital that the patients from Folateng get preference. Now, that's no good for me, because sick people deserve the same level of care. It doesn't matter what your income happens to be or whether you're insured or not.
Prof, as a result of that overcapacity, have some South Africans who needed care been failed?
Yeah, without doubt. So we're turning patients away, and people who really deserve, and I'm talking about really a really heavy burden of illness. I come from internal medicine, and we're facing the double burden of illness of communicable diseases, particularly HIV/AIDS and TB, as well as the non-communicable, the heart disease, the cancers, the respiratory illnesses. So there's a real problem of a population explosion in southern Gauteng. There are more people in need of care than the facilities that are available for it. And I'm looking for an immediate solution, for at least a stopgap measure, before strategic planning is taken to remedy the situation.
Okay, we'll get to the strategic question. If some patients have had to be turned away because of this undercapacity at Baragwanth in terms of certain facilities, does that mean, can we say with any certainty, whether or not some patients may, for example, have died as a result of a lack of opportunity to get specialist internal medical care?
I think that would be true. I'm sure that would be true. What the hospital does, and it helps under certain circumstances, is that we do decant patients to Selby Hospital, which is what we call a level 1 hospital. There are no specialists there really. It's a medical officer driven hospital. but it's not a specialist hospital. So I come back to the issue that the patients that we are dealing with are level 2 and 3. They need specialist care, and some are not able to access that care.
Okay. We do have the minister on the line as well. Is having a busy morning, and also we alerted him late to this discussion last night. But he's, like any good politician, willing to be part of this conversation in a solution-oriented manner, and also in terms of the importance of public accountability. Dr. Motsoaledi, I know you're extremely busy, but thank you so much for availing yourself to be part of this very important conversation.
Thank you very much. Thank you, Eusebius. I'm not very sure because I got into the middle. I'm not sure which doctor you're speaking to.
I'm speaking to Professor Ken Huddle from Baragwanth.
Yeah, that doesn't matter. I was just saying, because I got into the middle, I realized that is one of the doctors here.
Yes.
Okay.
But let me just frame the basic issue, which seems to me simple at its core. That in a public health facility, in some of our hospitals, like Helen Joseph, at Charlotte Maxtekle, that there are certain wards, the Folateng wards, that are there reserved for middle-class South Africans like Eusebius, well taken care of if they take it up. And those beds, if we count them, come up to close to 200 that could be available tomorrow if you made a call to those hospitals, Dr. Motsoaledi, and said, let's no longer reserve these beds. And then Professor Ken Huddle can send some poor South Africans who go to Barra, some die because of lack of capacity, they can at least be diverted to Helen Joseph. Are you prepared to pick up the phone and make that happen?
Yeah, well, look, Professor Ken Huddle is very, very correct, Eusebius. It's a policy position which still surprises me, how it came about. In fact, it's a policy position that I will never agree with, for the simple reason that it is an antithesis of the national health insurance we are coming up with. In the policy documents of national health insurance, we want to abolish that. I think it was a wrong policy position to try and solve an intractable problem in a wrong manner. When I was in an MEC for education in Limpopo, I questioned the similar policy at Baragwanth Hospital, where they were saying in order to attract people with medical aids to come to public hospitals to get extra income, they need to do this extra odds. I said, but this discrimination within the same institution, discrimination on the basis of the depth of your pocket is very wrong. Fortunately, Eusebius, the Vice Chancellor of VETS, Professor Habib, actually, he's still new in the job, raised the issue with me because he also doesn't like it. He said VETS has got shares in that Folateng, and VETS is a public institution. He doesn't understand why it must have shares in a private venture, and we agreed that we'll resolve the issue. Unfortunately, it's not as easy as picking up the phone because there've been contracts signed on some of these issues. I am dealing with the same issue. We heard about the same issue at Universitas Hospital in Bloemfontein, where professors literally employed by the state have got a private site where they are seeing their private patients. And when I raised that about it, I found that contracts were already drawn. We need to extricate ourselves from those contracts. But I can tell you, it is something that I'm dead against. It's something that we are looking at. I was happy when the Vice Chancellor of the University of Witwatersrand is of the same mind as me. It means the solution will be found. Save the issue of contractual obligations, which will find a way to deal with within the legal framework. So on that score, the professor is very right. But Eusebius, the other issue I want to mention, which the public must know about, are you still there?
Listening to every single word. I'm riveted.
Yeah. The other issue, Eusebius, is Bara itself. The problem in Bara is not inside Bara itself. Bara is a very, very seriously abnormal hospital, which I may say, while it is big and people in Soweto enjoy it, it was the manner in which it was planned was wrong, and we are also trying to correct that. According to the World Health Organization, they've got norms and standards. The norm and standard is that no hospital must have more than 1,200 beds. In fact, they say once a hospital has got more than 1,200 beds, it is unmanageable. They say you can try any management style under the sun, you're not going to manage it. There will always be problems. That is what Bara is, because instead of 1,200 beds, it actually has 2,888. In other words, it is 2.5 times a normal hospital under the norms of the World Health Organization. So whichever method of management you use is not going to work, because people, for instance, now, if you say there's a shortage at Bara, you increase the beds. You are moving very, very far from the norm. In fact, you are making the matter worse. So the solution here is to look around Soweto, where new hospitals need to be built. And that is what we are looking at. You are aware that Zola Jabulani Hospital is about to be open. It was very unfortunate that because of the problems in public works of that time, it took so long. But it was one of the solutions. The new Natal Spirit Hospital is going to be open very soon. It's bigger than the previous one. We have just opened Besa Goa Hospital in Jimiston. We are looking into the possibility of reopening Cape Town Park Hospital. In other words, you need a lot of hospitals around Gauteng, because you saw the census have just shown that more and more people are leaving rural provinces like Eastern Cape, Limpopo, KwaZulu-Natal to rush into Gauteng. The population is growing. Obviously, the services will be overstretched. You need new facilities. And I think that's... Hello?
No, I understand that, and I want to get the reaction of Prof Huddle in a second, and then I want to bring in Kirsten. But before I do that, in terms of the long-term plan and whether that's the solution and the implications for Bara as a hospital, many of the public love you because you are, rightly or wrongly, perceived to be a rare breed amongst politicians for your honesty. Here you are agreeing that this policy is unethical, it is undesirable. But one of my listeners react to that on Twitter and say, how? If the minister is agreeing to this point, how is it still policy?
So just come again.
Why is it still policy? If your opening statement in this discussion agrees it is undesirable to have a two-tier system, do you lack the legal power to already have stopped it?
No, I was just telling you that we are actually resolving it. It's not as easy as the listener is saying. It's not just signing a document and saying we are abolishing it tomorrow. Because as I said, they are contractual obligations. All our feelings.
What are those? Take me into your confidence, because I'm the taxpayer. I don't like this two-tier system. I have the same ethical intuition as you. When you say there are processes, do you agree with the principle? Just give me 1 second, Minister. I want the granular detail of what that legal block is.
No, Eusebius, I'm not ready with that yet, because I was not aware that you're going to be asking such detailed things. But we are already having a two-tier system in the Republic of South Africa, which is what we've been saying in the white paper. That the process of the white paper on which we are preparing on national health insurance, or let me say, which we have been saying in the concept of national health insurance, not the white paper, because it's not yet out. The whole concept is that the two-tier system results in the problems that we have been saying. So it's not something like the minister can wake up one day and saying this two-tier system between public and private, we abolish it. You need a process.
But Minister, there are two, with respect, there are two-tier systems in South Africa. There is the private health sector where Eusebius can opt into voluntarily based on his disposable income. And then there is, which is the very point of today's discussion, a two-tier system inside the public health system, where I would never have expected that as a taxpayer who's got a conscience about wanting the poor to be able to access an available bed in a public hospital. Are you not conflating the two different kinds of two-tier systems that we need to discuss as a country?
No. I'm not conflating them. I was just trying to show that there are two-tier systems already in South Africa. Instead of getting solved, the Department of Health then, at that time, tried to emulate the same wrong two-tier system now in the public health system. I'm agreeing with you, Eusebius, that it was wrong, very wrong. And I'm just telling you that we are trying to look into it, how to solve it. The Vice-Chancellor of the university is still relatively new when he raised it with me that let's sit down and solve this issue. It's something that we are looking at Please believe me, I don't support that system. And that's why I'm looking for solutions.
Just a final question, and then I really want to bring in the lawyer in the house just to talk through the legal aspects. Just a quick one, Doctor. The Folateng ward system has been in place in 2002. For how long have you disagreed with it?
Hello?
The Folateng ward system has been in place since 2002. In other words, for at least 12 years now. How long have you disagreed with it?
Well, when I came in and started discovering it, and I think I started understanding it 2 years ago when we were drawing the green paper on national health insurance. You know, you dig deeper into the system. Remember that, Eusebius, my job as a minister is about policies, norms, and standards. The actual running of healthcare systems happens in the provinces. So during the process of the drawing of the green paper on national health insurance 2 years ago, I came across these systems, the depth of understanding of these systems, how they work, where they are, and all that. And we are in the process of looking into it. It is the same thing as how hospitals were merged to try and you know, to try and apartheid between the township and a town hospital. Certain hospitals were merged into complexes where they have one CEO. I also discovered it then, and we started dismantling them. So it's quite a number of things that we need to change in preparation for the NHI.
Okay. Kirsten, I want you to come in here. I mean, it's interesting. What is great about this conversation is that ethically, Professor Ken Huddle, Dr. Motsoaledi, and Eusebius the citizen are on the same page about what needs to happen. Now it's a question of shifting the policy. As a lawyer, Kirsten, what are the blockages to changing this? How quickly can it be done? And what is your general reaction as a social justice lawyer listening to this conversation?
Thanks, Eusebius. I'll go with my reaction first. I think it's fantastic that we are all on the same page. And I think it's indicative of the kind of interaction that we always have with the minister. And we generally don't disagree with the minister because we generally see things in the same way. And he is one of those ministers who gets it. However, the fact remains that in the hospitals there is discrimination. Economic apartheid is alive and well, and there is a two-tier system. And the law remains the same. There is a right to equality, there is a right to dignity, there is a right to an environment that is not harmful to your health or well-being, and all of those rights that people have are being disrespected and violated by this situation that is allowed to continue. Everyone has a right to have access to healthcare services, and the state has to realize those rights. And the state has the obligation to respect, protect, promote, and fulfill those rights. And as long as these Folateng units are allowed to continue, and as long as those beds are being denied to patients who are being turned away from other units, those rights are being violated. So those blockages continue, and that needs to be addressed. So as much as we're encouraged by the fact that the minister agrees with us, this is more of the same. We frequently agree with the minister. What we need to see is some action, and what we want to know is how this is going to happen. As you say, the Folateng unit started in about 2002. I'm intrigued that the minister's only had concerns about them for the last 2 years. What happened before then? Why has the two-tiered system only been a problem for the last 2 years? I think it's been a problem for a lot longer than that.
Minister, I know you're busy. I'm going to let you go, but with one final question. From a practical point of view...
No, you don't have to let me go if this problem is not solved. I want to hear the finality of what people are saying.
Okay, let me reduce my niceness towards you. We're going to have a news break, but because I'm nice, I will tell you what the question is. I will ask you immediately after the news. What is the timeline we can have as citizens to hold you accountable on the same platform for when these wards should be closed, given that you concede it's desirable to close them?
Power Talk with Eusebius McKaiser. Weekdays, 9 a.m. to midday.
7 minutes after 11, we are closing our discussion on a very important news break event, which is that a number of doctors who work at Baragwanth Hospital has written a letter to the minister pleading that we stop a certain policy called the Folateng policy. In simple language, at some of our hospitals like Helen Joseph, certain beds are reserved for patients who have medical aid. But remember, these are hospitals that are public facilities, and so the question is it unethical? And these doctors believe it is, not because they hate middle-class people, but if these beds can be made available immediately, one less person might die and be turned away at a bigger facility like Baragwanth Hospital. We have the Minister of Health still with us for another 10 minutes, as well as Kirsten Whitworth, who's a lawyer for the Centre of Applied Legal Studies, and Professor Ken Huddle from Baragwanth Hospital. And I must say what's been great about the conversation so far is agreement that in principle these wards must go. The question now is, can we agree on a timeline, on practicalities forward? And just before we went to the break, the Minister was talking about the fact that there are contracts involved here. One would have to look into how to get out of them, but that he is on the same page as Professor Huddle about the undesirability of the status quo. Minister, I want to come back to you. We now have a little bit of time to hit the pause button. Practically speaking, how much time as a concerned citizen do you want from me before these wards are history?
Before I answer that, Eusebius, I heard you saying doctors have written a letter to me. I just want to inquire because whether they've written that letter to me, whether it's still coming, because the first time I heard about this issue was when you sent me an SMS last night that you received a letter from doctors. Was it coming in my direction, or were they just sending directly to a station, or is my letter still coming? I'm just interested in that because I'm hearing about it for the first time.
Okay, before we get back to the substantive issue of a timeline, Professor Huddle, just 1 second, Dr. Motsoaledi. I'm going to put the question directly to the person concerned. Obviously, all I care about as a taxpayer, as a voter, as a citizen with poor family is fixing the problem. But the stakeholders, Professor Huddle, need to obviously engage in good faith so that none of you end up stalling and my sisters end up being the losers in terms of not being able to access these facilities. Why did the minister find out about this through me calling him, feeling ambushed?
The letter is actually addressed to the South African Medical Journal. I and 16 of my senior colleagues penned the letter, and it will be published in the May edition of the South African Medical Journal.
So you couldn't directly try and engage the minister or the MECs? A medical journal are read by peers, not by political principals with power?
Well, we thought this was an appropriate way to get it in the public domain. We've been down this route in the 1980s. It was successful that time. We're hopeful that it's going to be successful again this time.
But the social justice lawyer next to you is praising this minister for his attitude of cooperation. So just from a strategic point of view, as we are fighting to realize progressively all the important aspects of the Bill of Rights, not just education, but also health, isn't it important to try non-adversarial manners? The minister is coming to the party in this conversation, but he probably is holding back on mild irritation, which is justified. No, Professor?
I don't think so. I think going to the South African Medical Journal, which is our professional journal, I think is appropriate. I'm a great supporter of our minister, and we've been in dialogue on many issues over the years. So it's not excluding anybody. We're putting it out in the public domain. And with radio shows like this, I've approached CALS as well, at WITS, etc. We're trying to find a way forward with the ultimate aim of really resolving this issue. Remember, it's not a simple issue to resolve. Folateng is a major issue, but there perhaps we can come to that a bit later. There's more to solving the problem than opening up Folateng beds for the public sector.
Kirsten, you know that our system is inherently adversarial. Once a lawyer is involved, it is no longer friendly conversation. You are accompanying the doctors here as a lawyer as much as you are smiling and you have a good human rights heart. I assume, for your sake, that one of the answers is that you have exhausted other avenues of communication?
We've had a long engagement with the National Department of Health and with the Provincial Department of Health. Wits University, the National Department and the Provincial Department signed a developmental accord on the 25th of July last year, in terms of which a plan was put in place to address various problems in the hospitals. We all agree that it's an excellent plan. We have seen various moves forward in terms of the plan. We've also seen some regression, and we are currently looking into it. At all times, the Minister has engaged with us very positively, but we also know that developmental accord does not preclude any other engagement with either the media or by individual doctors, and so or with other organizations. So the fact that Professor Huddle and other doctors have chosen to write to the South African Medical Journal is absolutely within their prerogative, and it was never precluded. And I think it's right that this kind of issue is in the public domain. A lot of the interventions that have taken place thus far have essentially taken place behind closed doors, and I think that's been a problem. Okay. So the general public do not know what's going on. So they just go into the hospitals, they see that things aren't working, and they don't know what's happening. At least this way, a discussion is being had. The public are hearing that the Minister supports the idea of the closure of the Folateng units, which I think is incredibly positive. Otherwise, if this discussion weren't happening, people would see the Folateng units, question their existence, and not know that the Minister supports their closure.
Minister, I know you don't use colourful language like I do, but are you pissed off?
Well, I'm used to this type of things. I've gone beyond the possibility of getting pissed off, but I just want to correct one thing from the lawyer there, Ms. Kirsten, that the development accord which I've signed with them and the Vice Chancellor, coincidentally, is an accord which I signed with all heads of departments on how to improve the situation in Hani, Baragwanth Hospital, Charlotte Maxeke, all the hospitals around what they call a vet precinct. I must state, however, that in that accord, nothing was said about Folateng, and I think I need to correct that.
Okay.
The issue of Folateng was never mentioned. It's an issue that was mentioned in conversation between me and the Vice Chancellor, as we always engage about developmental issues.
Okay, well, there are two miracles that have just happened. We're having an honest politician on and an honest lawyer. She agrees with you that it wasn't mentioned. Can we, by way of closing, though, just get some practical...
Are you saying Eusebius, politicians and lawyers are not usually honest?
Don't worry. There are worse things are said about us in the media, Doctor.
Okay.
But just by way of practicalities, the older I get, the more I care about outputs and less I care, to be honest, about processes and about talking cheap. What practically is the timeline you need before I know that up to 200 beds can be available for poor people without medical aid right now?
Eusebius, I wish I could say tomorrow, I've absolutely got no idea, because as I said, so some of the policies that happened in health over the past, it's difficult to find even their origins, documentation, etc. Take, for instance, the issue of CEOs of hospitals not being trained health workers or medical practitioners. It was practiced, as you know, we had to reverse it. And I've been looking for documents in which meeting was this policy made, how was it implemented. I found none. So you struggle to find some of these things because of what was happening then in the past. But I am not in a position, definitely, to say this is the timeline. I'll be lying if I say so, and I don't like to do that.
We appreciate that you don't lie, but unfortunately it does require me to ask the obvious accountability question. If you've been aware of it for 2 years, presumably even though you are in charge of overall strategic direction as the principal right at the top, that one of the things that you're also responsible for is the quality of your foot soldiers and acting your strategic vision. If that vision includes getting rid of a two-tier system like the Folateng wards, why have you not fired whichever legal mind is helping you dismantle these wards?
Well, I wouldn't know exactly why I'll be firing them for.
You'll be firing them for not assisting you on something that you've been unhappy with for at least 2 years.
I don't think they are not assisting me. As I said, I learned about this issue when we were developing the green paper, and we are seeking to incorporate it into policies. When you do some of these things, as Professor Ken Huddle said, they are going to the media to move society around. My way of moving society around was not to go to the media, was to look into new policies of health as we move forward. But now when the professor Habib raised it with me, that we need to discuss it bilaterally. We agreed that we'll come together to sit and see exactly how we put the process forward. We have not yet done so. Of course, you can blame us for wasting time on this issue. But remember that there are lots and lots of things which needs to be changed in the healthcare system and policies in the country, and this is just one of them.
I know, but on this one single issue, my final question to you is, when you get off the phone, when you get to your desk tomorrow, how far on top of your agenda will this be? Because remember, someone will be turned away this afternoon at Barra. This is much more important than the entertainment of Oscar Pistorius for the country. There are lives at risk right now, Minister. So I want to know from you as a citizen. Just give me a chance, Minister. I will give you full chance to respond. I promise you. The reason why I'm speaking with passion is that I'm not interested in the intellectual debate here about a two-tier system. I'm asking on behalf of that poor person who doesn't have airtime to call into Power Talk. For that person, they want a timeline. They don't want to know that there are processes that are complicated. If it means paying your way out of the contract system for the sake of the poor, why can't you do that? What practically will happen next?
Well, Eusebius, I agree that this is morally wrong, incomprehensible. The whole concept of the two-tier system inside the public hospital. There's no question about that. But I am saying in the short term, we must also devise other means. I don't think it's fair just to look at one particular solution in exclusion of others. For instance, the issue of somebody being turned away. I also want to know about it because I don't want any patient to be turned away. We always devise other plans to try and help, and I don't think it will be resolved by Professor Ken Huddle coming into publishing in the journal and going to the radio without saying today we have got 10 patients, Minister, they are going to be 10 back if you don't do something, because we definitely can do something about it in the very short term.
But the point is that if I count here, I'm trying to count, it's just under 200 beds that are suboptimally used at these other hospitals, Minister. So Ken is saying to you right now, Minister, I'm turning away patients. There are beds that are free. Okay, he wrote a letter to a journal, but now let's get over that. The conversation's now in the public space. For example, even if you let me give you a practical advice. Let's say I was your advisor, Minister, for 10 seconds. I would say, Minister, these people in the media are not going to go away. Even though you don't have the power, can you go and speak to the head of the hospital? Sometimes they're scared of you as a political principal, even though they shouldn't be. Would you, for example, do that much?
Yes, you see, the part I didn't know, which I'm shocked to hear, is that patients are being turned away when the bed is empty. I just know it's beds that are put for private patients for private use. But obviously, in all honesty, if the hospital has got no space at all, it will be grossly immoral to turn anybody away within the same hospital and say those beds there. It's not like it's in a full private hospital where you have got money to go and they've got no obligation to the public. That part of turning patients away when the bed is empty, I was not aware of it. I was under the impression that because these are private beds, 200 of them are always full, and they are complaining that patients who are poor don't have access to them because they've got no money. But if they say they are turned away when those beds are empty, that is grossly immoral. It can't be allowed. Nobody has ever told me about that. Even Dr. Ken Huddle has never picked up a phone and say, Minister, I've got 10 patients here and 10 empty beds. They are saying these patients cannot use the beds because they are private. That cannot be accepted.
Okay.
It's wrong.
Okay, we need to move on, Minister. I'll just give each of my guests here a final word in response, and then obviously you will be in touch with them. We'll put you in touch with each other, and we'll do a follow-up on this program in a couple of weeks' time to see where to from here. Professor Huddle, you've been very patiently listening after your opening statement, but every stakeholder needed to make a viewpoint. The Minister is shocked. The Minister is on the same page as you ethically, but what is your overall response to what you have heard?
Thanks, Eusebius. I think this has been a very useful discussion, but we really need results, because it's no exaggeration. Day to day, I know in my own hospital, we are running at over 100% occupancy at Barra, and there is no other place for patients to go because all the other hospitals are putting up their full sign. So that is a reality, and it's going to get worse progressively as it has over the last year, because of the burden of illness in Southern Gauteng and the population explosion. So yes, the opening of other hospitals like Zola Jabulani will be helpful, but it's not going to address a much bigger issue than the numbers really need another specialist, another one or two specialists facilities for the burden of illness that occurs in Soweto and beyond, because Barra is like a magnet for the country. So it's a plea from clinicians who cannot turn a blind eye to patients lying on the floor, patients doubling up in bed at Barra. We cannot continue this way. It's immoral, and for our staff it's terribly demoralizing to see that on a daily basis. And I'm giving you the exact truth of what happens day to day at Barra.
Kirsten, your final words from Centre of Applied Legal Studies?
I think I'd like to see a way that we can move this forward. As I said earlier, it's great that we're all agreeing and that it's immoral and unethical for these units to continue with empty beds. But we remain in violation of the law, and that is my key concern here. We know that there is suffering going on in the hospitals, and the UN Special Rapporteur on Torture has linked denial of healthcare to torture. And as long as that is going on in our hospitals, we remain in violation both of local and international law.
Okay, fascinating. We'll keep tabs on this story for you as a Power Talk listener. But I want to thank firstly Professor Ken Huddle for taking time out to join us to narrate his experiences as a professional at Baragwanth Hospital. Also to Kirsten Whitworth, who is a lawyer from Centre of Applied Legal Studies. And also very much to the Minister reacting in real time to a crisis, which is very difficult because you haven't had time to prepare. But we appreciate his acceptance that comes, I suppose, with the job, and also for being in dialogue with the other stakeholders. I hope this conversation is taken offline and we can bring you a positive second installment of what happened to it in a couple of weeks' time. Minister Motsoaledi, thank you so much for joining us.
Thank you, Eusebius. Can I just ask through you that even before the publication in the journal, can they be decent to me and just to send me the copy of that letter if we are to start dealing with this matter?
Professor?
Definitely.
There you have it. Call me Desmond Tutu. Thanks so much.
Okay, thanks a lot.